People struggling with severe mental illness will now be transported by first responders to a hospital for evaluation, without their consent if needed. This new directive by the mayor marks a major shift in how the city approaches mental health, as Lisa Daly with the Treatment Advocacy Center explains.
This is really kind of an acknowledgement that there's this very large segment of the population of people with severe mental illness that's untreated.
But many are concerned with the lack of resources available to help the number of people who will soon be flooding the system. When a person is transported to a hospital, they're placed in a psychiatric bed, and the number of those beds throughout the city are severely limited. Many are still offline from the pandemic. But not only does the city need more beds, it also needs the people to staff those beds as well.
I've spoken with people who said, well, my hospital has these 2 psychiatric wings and we can only staff one of them because we don't have enough providers.
Maya Kaufman is a healthcare reporter for Crain's New York Business and did a 6-month investigation into the state's mental health system. Once patients are admitted into a hospital, they can often fall through the cracks before being connected to continuing care. This is something the mayor is hoping to change, but Kaufman says a wait list for many of these community outpatient programs can be up to a year.
This is because we're speaking about really high intensity programs that are meeting with people multiple times a week. They get whole teams of providers, not just one therapist or psychiatrist.
But going hand in hand with treatment is affordable housing. Once a person is moved to an outpatient treatment program, they will often need a place to live, which can again backlog the system.
And involuntary hospitalization can be very traumatic and can be very upsetting. But if you're going to do that, make use of that. Make sure that the person actually receives treatment, stabilization, and then really invest in making sure that the person's able to succeed when they're ready to be discharged.
And one of the top missing details from the mayor's plan is accountability. How will the city make sure that the right people are being transported to the hospital for care? Reporting from the newsroom, I'm Morgan Mackay, Fox 5 News.